So good morning, one and all. Um, one sec. Good morning, one and all. I have no financial interest, no conflict of interest. So today I'll be talking about SmartScope Kit, which is a portable eye hospital for screening and outreach camps. I'm Dr. Hirika Gosalia, a postgraduate resident from a tertiary eye care center, catering to a large population, giving high quality service at an affordable rate. Uh, by which we conduct outreach camps. We go to outreach camps wherein we are not able to use the conventional instruments, which is quite bulky and can lead to damage during the travel. So, in the outreach camps that we go, we mainly screen cataract patients. So here you can see how I'm going to the outreach camp, and we go to most patients with old patients with cataract, and we screen their anterior segment with the torchlight and the posterior segment with the direct ophthalmoscope, and then we refer them to the base hospital. So the problem here was that this was not sufficient to screen many other pathologies, and that's when we came up with a SmartScope kit, which is a comprehensive ophthalmic kit. Which can do all the necessity investigations. So for visual acuity, we use the smartphone-based free download, which is the eye handbook, by which we can do visual acuity tests, Amsler's grid, color vision. We use the pinhole, we put the pinhole, occluder, and the trial frame. We can also carry along the trial set. Then for anterior investigations of the systemic illness, mainly we use the BP machine, the SpO2, the torch for examination. Then we use many of the investigations required for the corneal pathologies and the orbital with syringing. And for the anterior segment, we use many innovative devices. We use the iverter, which we use for eversion of the lids, especially for foreign body removal. We use the ASPE, which is the anterior segment photography with intraocular lens, wherein we used which was a great alternative to the slit lamp to examine anterior segment pathologies. So we take a cardboard, we punch the hole, and then we place a 15 diopter intraocular lens at the hole, which is very good for magnifying and giving great resolution to image anterior segment images, which we put on the smartphone. And these are findings that we found at the outreach camps, ranging from corneal findings to cataract findings to neovascular glaucoma to pterygium, and you can see how the resolution and the magnification is. Then we use Shiot's tonometry for measuring the intraocular pressure. We later use we screen the patients for narrow angles, and then we use the ASPE gonio with 8 diopter lens to check the angle of the anterior chamber. Then we heap 4 intraocular lenses of 30 diopters upon each other, which created the AIOL-scope, which was an alternative to the compound microscope, to screen patients with ulcers, to detect fungal hyphae, and we also diagnosed a screened sheep botfly larvae with a patient with foreign body sensation. And we use the Scooby-Doo, which is a smartphone aided cobalt blue filter alternative, wherein we attach the blue filter and the 15 diopter lens to screen many of the corneal findings with dry eye, epithelial edema, epithelial defect, filamentary keratitis, and many other corneal pathologies. And these are all the anterior segment devices that we used. Posterior segment, we used the trash to treasure red cam, wherein we used a sanitizer bottle, and at the edge we cut a round circle wherein we attached a 20 diopter lens. Then on the other side we attached the adapter along with the phone, and this on the other side, then we put it on the patient's eye of pathology to record many of the posterior segment findings. So the results were, we found 83% of cataract patient, and next was retina patients, mainly diabetic retinopathy patients, then corneal findings, glaucoma findings. Others were orbit and neurophthal findings. So in cataract, we mostly found the immature cataracts ranging around 720 patients, mature cataracts. So mainly this was between 4,721 patients conducted across camps across Tamil Nadu, Karnataka, and Kerala. And in orbit, chalazion was most found. In neurophthal, most found was optic neuropathy. In retina, diabetic retinopathy, macular hole was found. So out of the 4,741 patients across 26 camps, we found around 800 patients were referred to the main center. And there is some issue. 800 patients were referred to the base camp, out of which 200 were received treatment in the cataract section. And out of the patients in the non-cataract, which were the corneal and orbit findings, we referred patients of around 195, and around 85 were treated at the base hospital. So all I'm trying to say is that SmartScope kit is a great alternative to the existing system, and we can screen many segments from the anterior to the posterior segments. 1 second, just give me 2 minutes. It's here. Yeah. So coming to results, so out of 4,471 patients, cataract patients were 1,220 patients, and out of which around 700 were referred to the base center for cataract surgery. And out of that, non-cataract patient 195 were asked to go to the base hospital, and around 95 were received treatment. So SmartScope kit was a great alternative, ASPE being an alternative to the slit lamp, IOL-scope being an alternative to the compound microscope, Scooby-Doo being the alternative to the cobalt blue filter, and the trash to treasure red cam being an alternative to the fundus photography, which is the normal indirect ophthalmoscope. So I would like to ask everybody to use the SmartScope kit to screen, to not miss any diagnosis and to avoid misdiagnosis. Thank you. No, we as residents have tried to use it. Whoever goes, we try to capture images, and we discuss if we need referrals, if we are in doubt. So it's a new initiative. We use innovative tools. It's not been used earlier, but right now, since the study we have started, we are using it for all camps. Yes. Only one, ma'am. We were just attaching. Yes, yeah, ma'am. Yes. Not Fevicol, ma'am. It's just a tape, ma'am. It's Yes, ma'am. Yes, ma'am. Yes, ma'am. Yes, ma'am. No, ma'am. So accordingly, we are not using all the devices for all patients. We'll use it according to the patient's complaints. So if the patient is coming with a poor visual, yes, ma'am. Yes, ma'am. Yes, ma'am. Yes, ma'am. Yes, ma'am. It was adding up to around 7 to 10 minutes more.
Very innovative products. I think next time you should present it in the innovation section.
Yes, ma'am. Yes, ma'am. Thank you.